Dr. Mark Nikkel is a fellowship-trained and board-certified sports medicine surgeon at Bronson Orthopedic and Joint Specialists. He provides orthopedic care for individuals in and around South Haven. Dr. Nikkel works in partnership with physician assistant Kathleen Martinez. Doctor, what is a rotator cuff injury and how does someone become injured?
Great question. The rotator cuff consists of four tendons that surround the shoulder joint and attach the upper arm bone, i.e. the humerus, to the shoulder blade or the scapula. The rotator cuff main function is to stabilize the shoulder and upper arm during movement, allowing for full range of motion and a variety of arm and shoulder motions.
Okay.
Rotator cuff injuries are common, especially in people over 40 years of age, athletes, and those who repeatedly lift their arms overhead. Examples of this would be strenuous and physical jobs, sports injuries, and then age-related wear and tear.
What are the symptoms of a rotator cuff injury, and when should someone see a doctor?
Symptoms include pain, weakness when moving the arm, grinding or cracking when moving the shoulder, and limited range of motion. The one thing that usually brings patients into the doctor is sleep disturbance. As soon as someone's sleep is interrupted, they want to see the doctor.
How do you diagnose a rotator cuff injury?
Rotator cuff injury is diagnosed by a patient's history and physical exam, X-ray evaluation. But the gold standard diagnostic modality is an MRI.
What are the treatment options for a rotator cuff injury?
Non-surgical treatment options for rotator cuff injury involve injections, medications, and physical therapy. Surgical options for rotator cuff injury utilize arthroscopic surgery and repair.
So when a surgical intervention is needed, what sort of patient education and preparedness is offered?
When I meet with the patient, I explain the anatomy as well as the pathoanatomy / the injury using an anatomic model. I also review the MRI, and I show on the MRI the injury / tear. We talk about the procedure, which is outpatient, recovery, and rehabilitation.
So what is the recovery and rehabilitation process like for rotator cuff injuries?
The recovery and rehabilitation for rotator cuff injuries involves approximately 4 to 6 months. Obviously, it varies amongst patients and the level of the surgery that we do. Therapy usually is 2 to 3 times a week, and basically what we work on initially is returning motion to normal, and then once we get to a certain point in recovery, we work on strengthening.
How would someone inquire about scheduling an appointment?
They can call us at 855-618-2676. Same-day orthopedic appointments may be available. Same-day appointments are based on the level of care needed, the time of day you call, and provider availability. Please visit bronsonhealth.com/ortho for more information on all the orthopedic care available at Bronson.
Thank you, Doctor. Dr. Mark Nikkel, fellowship-trained and board-certified sports medicine surgeon at Bronson Orthopedic and Joint Specialists.